Good morning, guys. Before we explore how to come off TRT, I suppose the real question should be, why did you go on TRT? Because it should be to reverse the negative symptoms that you presented with. And if TRT has not done that, is it a problem with the TRT protocol, or is it a problem with another aspect of your life that also needs addressing? When I think about TRT, I do obviously think about reversing these negative symptoms, but I'm actually more concerned with maintaining long-term physical and psychological well-being and understanding the premise behind normalization of your male androgen levels is to help facilitate growth and repair. Obviously, I'm concerned about the negative symptoms that you're presenting with, but if you can bring the body into balance and address every single aspect of your health, then you will actually reverse those negative symptoms. Now, leave the hormones to me. That's what I do. So I ask you to hand over some responsibility to me, but I also hand some back because I think it's super important that you take responsibility for your own health and not adopt this sort of paternalistic attitude that we have, which has been ingrained in our psyche through the NHS. And unfortunately, the needs of the individual are outweighed by the needs of the collective. And that's slightly distorted by the current model and the needs of the NHS, which are just absolutely absurd right now. So before we go down on a political rant, we won't go down on a political rant because I can't be asked. You need to take some responsibility for your own health. So concentrating on those aspects of life that should bring you some pleasure. Look at your lifestyle. Make sure your sleep is appropriate, good sleep hygiene. Make sure you try and reduce stress as much as possible, realizing that the psychological stress that this modern world brings isn't necessarily very good for us, because if you go back to hunter-gatherer days, you should be thinking about physical and psychological stress. So I do emphasize to my guys who are under a lot of psychological stress to make sure that they release all of that adrenaline through physical exercise, because we should be active every single day. Nutrition, etc., etc. So, why would you come off TRT? One of my guys recently, disappointingly, had to come off because of financial issues. Now, this pandemic has had a catastrophic effect to the individual, and he had to come off simply because he couldn't afford to continue therapy, which is very disappointing because he was actually super happy and he's actually super grateful as well. So he said as soon as he can afford it, he's going to come back on. If you haven't reversed the negative symptoms that you presented with, now again, that comes to addressing causation. So appreciating that we are complicated human beings, optimizing your hormones isn't enough to say, well, why don't I feel amazing? You do have to work on these other aspects, and that's integral to success. What else? We fixate on numbers. Now, when you have low testosterone, you confirm the diagnosis with diagnostic bloods. So it's obvious and logical to fixate on numbers. Now, the reference range is a wide range. Now, it does not take age into consideration. It reflects a sick society. So, quite reasonably, we want to be high normal because we want to feel good. Now, We spoke about this 19-year-old yesterday who had borderline low levels, but is flying. We spoke a few weeks ago about a guy in his 50s who presented on the recommendation of another patient just for a screening test. And he was completely asymptomatic, firing on all cylinders. He used to get wood on a long journey. I say long journey, 40 minutes in the car. So again, we decided not to start him on TRT, despite having, in inverted commas, low normal levels, because it wasn't in his best interests. I had a guy a few days ago, early 20s. He hasn't seen the benefit of TRT. In fact, it's made him super anxious. His numbers have always been pretty spot on. So we've been tinkering. It's been very much fine-tuning. Now, he was on testosterone and HCG, testosterone monotherapy, testosterone and microdosing examestane, proviron. Each and every one of them, each and every protocol change caused anxiety. Now, his quantitative numbers were also perfect on paper, but he may be one of these guys that actually wants to be low normal. And since he's been on TRT, he has made strides in helping his nutritional needs and reducing stress, despite the TRT apparently causing anxiety, which is so disappointing, because TRT can have a dramatic effect on mental well-being. But it isn't a one-size-fits-all methodology, and my perfect numbers will not be the same as your perfect numbers. So this guy now, he's feeling a lot better physically. He has addressed all of the other issues that he presented with, and he's decided to come off. And I think it is a wise decision, because we have struggled with him. Very disappointing. But weighing the pros, weighing the cons, it's probably best that he does trial coming off, and let's see if we can have a baseline. All this chopping and changing isn't good sometimes. So what are we going to do for him? Now, when you're on testosterone monotherapy, what that does, it suppresses the signals to the hypothalamus and the pituitary. So you no longer send LH and FSH down to the testicles. So they can atrophy. I'm a massive advocate of maintaining function with HCG and optimizing testosterone levels with testosterone. So, if somebody wants to come off testosterone replacement therapy for whatever reason, if they've been on HCG, they have maintained testicular function. So that process would be far simpler than if they've been on testosterone monotherapy, where the hypothalamus and pituitary have been suppressed and LH and FSH have not been sent down and the testicles have atrophied. So you can just come off cold turkey, and in theory your levels will go back to where they were pre-TRT. Now, it would be interesting to see where this guy's levels go back, because he has made some lifestyle changes, and if that was contributing to his low testosterone pre-TRT, it would be interesting to see where his numbers can actually go to, whether they recover, whether they actually become more healthy. I've got another guy, interestingly, who's had a massive transformation, and he's super young as well. And I'm going to have the conversation with him, because he's been on HCG as well, to see if he actually wants to come off therapy. because he's been out. He's, again, financially, disappointingly, he's been out without therapy for a little while, and he still feels great. So people often make the comparison between type 2 diabetes and testosterone deficiency. It's not really a fair comparison because of the fact that testosterone suppresses the hypothalamus and pituitary. So with type 2 diabetes, you could obviously reverse the things that are causing your type 2 diabetes, namely being a chunky monkey, and no longer need the medications. It's not quite as simple with testosterone deficiency, but it's simpler or more simple, with the concurrent use of HCG alongside testosterone. So you're maintaining testicular function. So in theory, you should recover. Weeks, months. Unfortunately, it's how long is a piece of string. Now, lots of guys who have done steroids have approached the NHS and they've been told it's functional hypogonadism, you will recover. And it's okay. But how reasonable is it to wait 10 years? Well, it's not reasonable, is it? Because obviously, you know, we've only got a finite amount of time on this planet. So to suffer for 10 years because of the theory or hypothesis that you will naturally recover seems rather unfair. So we should always act in the best interests of the patient. So, what else can you do? You can also do a medical restart protocol. Now, what does that involve? That involves high-dose HCG to stimulate the testicles, tamoxifen, which is a peripheral estrogen antagonist, to counteract the effects of the HCG, and clomiphene, the central estrogen antagonist, to stimulate the brain into producing LH and FSH. Now, if we go back to the HPG axis, the hypopituitary gonadal axis, and you have an understanding of that, you'll understand why we're doing these things. Essentially, it's a jump start to the hypothalamus, pituitary, and testicles. Now, it can only work if the causative factors that led you to have low testosterone are no longer present. So it's incredibly important to make sure that your lifestyle, your nutrition, and your exercise is in check. Incredibly important, because otherwise you're just going to go back to square one. It shouldn't be a flippant decision. TRT is a lifelong therapy, but in theory you can come off. Now, as with everything, there are risks, and it isn't simply a matter of just going back to how you were before. Some of these medications have serious side effects, and they're controlled drugs. So clomiphene, one of the most serious potential side effects is optic neuritis. So this is not something that you should do off your own volition. This should be a medically supervised therapy, and you need to have somebody that can be objective and give you some decent advice, and not listen to the bros down at the gym, because that was obviously counterproductive. So, TRT. You should only go on TRT with a medical need. It is not a lifestyle drug. It's involved. It isn't always successful. You have to put the hard work in. You need to address causation. In theory, you can come off it and recover to where you were before testosterone replacement therapy. You can sometimes recover to a better place if you have addressed causation. But eyes wide open, guys.